The over 300 members of the association comprise laboratory scientists, laboratory technicians, and laboratory assistants. They argue professional members of the association who qualify for vacant positions have been sidelined. Members at an emergency meeting on Wednesday resolved to stay off duty.
The outcome from the membership of GAM's KTA chapter is very simple. From tomorrow, Thursday, the 20th of May, we are beginning a sit-down strike where we will come to work, but we will not work. So no patient sample, no sample from anywhere will be worked on in our labs in KATH from tomorrow, Thursday, 20th May, up to next week, Wednesday, 26th of May, 2021.
Local Union Chairman Ernest Bedu-Boatin tells Joy News the lab professionals are appalled by the stance taken by management of KATH.
The laboratory profession over the years have matured and have grown. And so there are professionals within the laboratory services and within our professional cadre who have been licensed by the Allied Profession Council and are being monitored and their practice controlled by the Allied Profession Council. Same way these medical officers are also being licensed by the MDC, the Medical Data Council, and also have their own professional line of practice. There is no conflict between their line and our line. They are clinicians, we are laboratory. We practice laboratory science, they practice medicine. The two are different by law under Act 857. And so all we are saying is that they should be in their lane. They should practice their medicine and also leave us to practice our medical laboratory science as defined by law that was passed by Parliament in 2013. And so the presence of these people in our lab, what it means is that, what they are telling is that our consultants who are fellows of the West African College of Medical Laboratory Science, who hold their PhDs, who hold their masters, don't have that qualification, or they don't come near the job that these LPs are coming to do. And that we will not agree, because the two professions are different. And where they interrelate is where a doctor will request for a test to be done on a patient. Then the lab will come in and perform that diagnostic test, so the doctor will use the results to treat the patient. It is not the duty of the doctor to come to the lab, request a lab test, come to the lab, run the lab test himself or herself, and now use the result. That is not done. And that is what we are fighting against.
The action of the association is expected to affect diagnosis, investigations, and treatment of patients at that teaching hospital. The hospital is also expected to lose revenue if the strike is protracted. Yes. But Mr. Bedu-Boatin says members have no option than to resort to the action.
We have laboratory scientists, we have laboratory technicians, we have laboratory assistants, all within our cadre. So all of us are working here, and all of us, we are the ones manning all the labs in KATH. We are the professionals who are running all the tests that patients, when patients come here, they go through before they are given drugs or they are treated. So the impact of this strike, I can tell you, is enormous. Besides that, we are the revenue generating, one of the highest revenue generating directories in Komfo Anokye. So that I can tell you that even a day, if a day without work, a day without LSD generating money, this hospital will suffer financially. And so the earlier they resolve this matter, the better for even the financial health of this hospital.
Meanwhile, management of KATH has declined commenting on the impasse. From Kumasi, for Joy News, Oimi Interior reporting.